Hello. How much do you know about your hormones and how they affect your body both mentally and physically? Today we're diving into that topic that every man needs to understand: hormones. From testosterone to cortisol, these chemical messengers affect everything from your energy, mood, muscle growth, to your sleep, and even your sex drive. But how do they actually work? What throws them off balance? And most importantly, how can you take control of them? Stick around because we're breaking it all down in a way that's easy to understand and relevant to your daily life. So first, testosterone. It's more than just a hormone. It's a biological engine that drives much of what defines male health and vitality. So the key roles of testosterone: muscle growth, bone strength, red blood cell production, libido, mood regulation. So there's a natural decline, and what are the symptoms? Testosterone levels peak during adolescence and early adulthood, but starting around age 30, they begin to decline, slowly but steadily. This natural drop can lead to noticeable changes. Some common symptoms of low testosterone are fatigue, reduced libido, depression or irritability, decreased muscle mass, increased body fat. So why does it matter? Low testosterone isn't just about feeling sluggish. It's linked to serious health risk, including heart disease, diabetes, cognitive decline. Testosterone helps regulate key functions in the male body. When it drops too low, the risks go beyond quality of life. They become medical concerns. So, what's the testing and treatment? So, are you concerned about your levels? Well, a simple blood test can tell you a lot. If levels are low, lifestyle changes, hormone replacement therapy, or other medical interventions can help. Boosting testosterone naturally you can do through regular strength training, adequate sleep, healthy fats in your diet, managing your stress, and avoiding excess alcohol. But in most cases, these will only affect your levels by 10%. So testosterone isn't just about strength. It's about balance, energy, and well-being. Understanding and managing your levels is one of the most powerful steps you can take for a long life. Cortisol. It's often called the stress hormone. It's produced by the adrenal gland, which sits on top of your kidneys. Don't be fooled. Cortisol isn't just about stress. In men, cortisol plays a vital role in everyday life. It helps regulate energy levels, especially in the morning, giving you that get up and go. Metabolism, breaking down fats, proteins, and carbs. Your blood pressure, keeping it in check during physical or emotional stress. And even immune responses, helping fight inflammation and infections. So your stress response. During stress, whether you're in a high-stakes meeting or running from danger, cortisol spikes. This triggers the fight or flight response. Heart rate rises, glucose floods your bloodstreams for quick energy, and your focus sharpens. This reaction is key to survival. But here's the catch: when cortisol goes wrong, too much cortisol leads to problems like weight gain, especially around the belly, poor sleep, low testosterone, anxiety, depression, and brain fog, even muscle loss and low libido, and can contribute to a higher risk of stroke for men. These effects can seriously impact both physical performance and mental health. So how to balance cortisol? You exercise regularly, but don't overtrain. Sleep at least 7 to 8 hours a night. Eat balanced meals with protein and healthy fats. And most importantly, manage stress through mindfulness, deep breathing, or even just taking a break. Cortisol isn't your enemy. It's a powerful ally when balanced. Understanding how it works can help you perform better, feel better, and live longer. Around 10 years ago, I found out that my cortisol levels were way out of control, along with 3 other hormone levels. The doctor said that my levels were the highest he had seen in 20 years. He said it was as if I was under constant stress. If I didn't change something in my life, then I would be dead in 8 years from a stroke or heart-related episode. That day, I decided to change my entire lifestyle. I was already going to the gym on a daily basis, but I was forcing myself to go because I didn't have the energy all the time, and my weight loss was slow. I changed my eating habits and got with a great trainer who not just trained me how to work out for me, but how your body actually works and responds to different types of training. The doctor started me on 4 shots per week and some other medication that was in pill form. I do not want to say the medication because this should be recommended by an actual doctor who specializes in hormones. After 2 years of being on the medication and getting blood work done, every 3 months my levels were now under control, to the extent that the doctor was happy. I've continued to get my blood work done every 3 months, and I've changed my job profession to a less stressful job. I enjoy life and want to be around for as long as I can and remain active. I will say I did start noticing a difference in my mood and sleep after just 3 weeks on the medication. During my treatment, at one point, I was taking 5 injections per week, 5 pills, 3 times a week. I changed my entire diet. I go out of my way to work out at least 5 days a week. Now, when I go out for dinner with friends from work or something, I don't stay strict to my diet because my fitness and health are in control now, and I can handle eating outside of my normal diet once in a while. So I hope this helps you guys out there in thinking about getting tested and being around for a long time. So you should always stay informed, stay strong, and go get tested. That way you know what you can do to be around for a long time for yourself and your family. And by the way, I would greatly appreciate a like and subscribe, and thanks for watching.